Bismillahirrahmanirrahim. Today we will discuss the second part of the lymphoid tissue. In this lecture, we will discuss the lymphoid organ, lymph node. First, we come to the general features of the lymph node. Lymph nodes are oval or bean-shaped structures situated along the course of lymphatic vessels, as we see in this diagram. These are different lymph nodes in different areas. The lymph nodes serve as filters of lymph, removing particulate matter and bacteria from lymph before it enters the CVS. In this way, they prevent the spread of infection. Lymph nodes are usually found in groups. Here we see the axillary lymph nodes. Here we see inguinal lymph nodes, especially in the axilla and inguinal region and root of the lung, etc. Now we see the picture of the lymph node. The lymph nodes has many afferent lymph vessels. These are afferent lymph vessels which enter the lymph node on its convex surface. And here we see the efferent lymph vessels, which are 1 or 2 in number, and they leave the lymph node through concave depression. And this concave depression is called hilum. This hilum also transmits nerves and blood vessels. The lymph vessels, here we see the valves. The lymph vessels are provided with valves in such a way that the lymph flows in one direction. Now we come to the structure or component of the lymph node. First one is the connective tissue framework, which consists of capsule, trabeculae. This is capsule, and these are trabeculae, and reticular stroma. And the second component is the parenchyma, which has cortex under the capsule, and then paracortex, you can say it inner cortex, and in the deeper part, medulla. Now we come in further detail. Here, connective tissue framework, which consists of capsule and trabeculae. If we see the capsule, this surrounds the organ, which is thin connective tissue and has trabeculae into its interior part. Beneath the capsule, there is small area which is subcapsular sinus, and it is traversed by reticular fibers and cells. The subcapsular sinus receives afferent vessels and is continuous with the trabecular sinus. Here is the trabecular sinus, which is found around the trabeculae. And these trabecular sinuses become continuous with the medullary sinuses. Here we will see the structure of medulla, which consists of medullary sinuses. This is a magnified picture, capsule, subcapsular sinus, and here is the trabeculae, and around the trabeculae are the trabecular sinuses, which are continuous with this lighter area in the medulla that are medullary sinuses. Now we come to the reticular stroma. It is made up of reticular fibers and phagocytic reticular cells, and they form meshwork throughout the organ. And this is dense in the area of cortex. And this reticular stroma gives structural support to the lymphoid cells, or you can say the parenchyma. The parenchyma is lymphoid tissue which is present in cortex, paracortex, and medulla. Now we see the cortex in detail. The cortex is the peripheral part of the lymph node situated deep to the, this is capsule, deep to the capsule. And it contains following structures. Number one, subcapsular sinus, which is beneath the capsule. Next is lymphatic nodule. This big area is called lymphatic nodules. And it has germinal center, or it has not germinal center, with or without germinal center. If a lymphatic nodule is without germinal center, it is called primary nodule, whereas one with germinal center is called secondary nodules. Here is a slide of lymph node. Here we see capsule on the outer surface. Under the capsule, subcapsular sinus, and in the cortex, these lymphatic nodules, which are germinal center, and these are the trabeculae. These are the identification points of the lymph node, lymphatic nodule in the cortex. These are nodules. Subcapsular sinus, medullary cords and sinuses in the medulla. This is the deeper part, medulla, which has medullary cords and sinuses, and a thin capsule. Here we see the germinal center. This germinal center contains large lymphoblasts with more cytoplasm and lighter nuclei as compared to lymphocytes at the periphery of the nodule. Here lymphocytes, and in the center, which is lighter, this has lymphoblasts. Now we come to the paracortex. It is inner cortical zone. Here is the paracortex, which does not have precise boundary with the outer cortex. There is no demarcation between cortex and paracortex. It consists of T lymphocytes and is called thymus dependent zone. Here no nodule is seen in paracortex, but sometimes discrete lymphatic nodules are seen. The dense lymphoid tissue in the paracortex becomes continuous with the medullary cords. This lighter area shows medullary, this is medullary sinus, and the darker area shows medullary cords. So if we see the paracortex, this darkly stained area, this is continuous with the medullary cords. Now we come to the medulla. Medulla has two components, the medullary cords and the medullary sinuses. The medullary cords are branching and anastomosing cords of typical lymphoid tissue. These darker area has typical lymphoid tissue, which are which is a branching pattern. Here we can see, and made up of primarily of B lymphocytes. And it has few plasma cells and macrophages. Now we come to the medullary sinuses, which are atypical lymphoid tissue, this lighter area, and it is disposed between the medullary cords. As in subcapsular and trabecular sinuses, the medullary sinuses are traversed by reticular fibers. Here also reticular fibers are present, which support the macrophages, B lymphocytes, and plasma cells. The medullary sinuses are lightly stained compared to the darkly stained medullary cords. Medullary sinuses drain into efferent lymphatics or lymph vessels found at the hilum. Here is magnified picture where we can see the structure of the medulla. These are medullary sinuses, these are medullary, and these are medullary cords. This schematic diagram shows the flow of lymph. Lymph comes by afferent lymph vessels of the lymph nodes. Then it comes into the subcapsular sinus. From this, here, it goes into the trabecular sinus, and from the trabecular sinuses into the medullary sinuses. And they are drained to the efferent lymph vessels, which are present at the hilum of the lymph node. Now we come to the another structure, which is spleen. This is largest lymphoid organ present in the upper part of the abdominal cavity behind the stomach and is completely covered by the peritoneum. Here is the spleen. It is blood forming organ in fetal life and blood destroying organ in the postnatal life. That is why it is called graveyard of the RBCs. Since it is in the bloodstream, it filters blood from blood-borne antigens and microorganisms. Now we come to the components of the spleen. First one is the connective tissue framework, which is also composed of capsule, trabeculae, and reticular stroma. Second component is the parenchyma. Here it is composed of white pulp, which is typical lymphoid tissue, and second is the red pulp, which is atypical lymphoid tissue. Here we can compare it with the lymph node, where parenchyma was cortex, paracortex, and medulla. But here no cortex and medulla. Now we study the connective tissue framework. First one is capsule, which covers the spleen completely. Here we can see capsule. Then deep to the capsule, this capsule lies deep to the peritoneum or mesothelial covering. And this capsule is formed by dense collagenous connective tissue and few smooth muscle fibers. There were no smooth muscle fibers on the capsule of the lymph node, but here there are smooth muscle fibers. When these smooth muscle fibers contract, they cause pumping of blood from the spleen into circulation. That is why spleen acts as a reservoir of blood. The trabeculae, these are septa which are given off from the capsule into the substance of the spleen. They are thick and tough. They carry trabecular vessels, which are branches of splenic vessels. The reticular stroma, it is made of reticular fibers and associated phagocytic reticular cells, which form a meshwork throughout the organ. And this reticular stroma supports the cells of the parenchyma. If we see the parenchyma, on examination with naked eye, the interior of spleen shows rounded white or gray areas surrounded by red matrix. These are the gray areas, rounded gray areas, which are surrounded by the red matrix. These round gray areas are called white pulp. Here we can see white pulp. This is also white pulp. Around these white pulps, this area is red matrix, which is called red pulp. Now we see the white pulp. Microscopically, the white pulp is made up of aggregation of lymphoid tissue. This is aggregation of lymphoid tissue around a small artery or arteriole. And this artery is a branch of trabecular artery that leaves the trabeculum and enters the pulp. When it enters the pulp, it is surrounded by lymphoid tissue. Here we call it periarterial lymphatic sheath, pulse, periarterial lymphatic sheath, which has T lymphocytes. And this artery becomes central artery or white pulp artery. When it is surrounded by periarterial lymphatic sheath, then this artery is called central artery or white pulp artery. Here we can see the central artery. This is lymphatic nodule, which has lymphocytes and lymphoblasts. These lymphoblasts are in the germinal center. Now we can see this along the course of periarterial lymphatic sheath, there are a large collection of B lymphocytes forming lymphatic nodules with germinal center. In these nodules, the central artery occupies an eccentric position, but is still called the center artery. It does not occupy the central position, but it is called central artery. The lymphatic nodules, that is white pulp, are surrounded by an immunologically active zone containing many macrophages, few T lymphocytes, and blood sinuses. This zone. This functional zone between white and red pulp is called marginal zones. This is marginal zone around the white pulp. The central artery or arteriole leaves the lymphatic sheath of white pulp and enters the red pulp, where it divides to form straight peninsular arterioles. These are straight peninsular arterioles. The peninsular terminate as arterial capillaries. Then it becomes arterial capillaries. Now we come to the red pulp. Red pulp is a modified lymphoid tissue which is infiltrated with all the cells of the circulating blood and giving it red color. It is composed of irregular anastomosing splenic cords of Billroth and broad splenic venous sinuses in between the cords. So two main structures are seen in the red pulp. One is the splenic cords of Billroth, and second is the splenic venous sinuses. What are the splenic cords? The splenic cords of Billroth basically are spongy network of reticular fibers which are infiltrated with reticular cells, lymphocytes, macrophages, plasma cells, and all the elements of the circulating blood. And the second component, splenic venous sinuses, they are lined by elongated spindle-shaped endothelial cells which are called stave cells. And we can see these cells, they lie parallel to the long axis of the sinuses on a discontinuous basement membrane. Here we can see in 3D picture these cells, spindle-shaped cells, lie along the long axis. And in cross section, this splenic sinus shows discontinuous endothelium. So these are the sinuses, and the second part, this is splenic cords of Billroth, which is meshwork, connected tissue meshwork, reticular fibers, and different types of cells. Here is another picture of the spleen, which is magnified. White pulp, red pulp. This is red pulp. Now we come to the theories of splenic circulation. There are two main theories which are proposed to explain the mode of termination of the arterial capillaries of the peninsulae into the venous sinuses of the red pulp. First one is the closed circulation theory. According to this theory, blood passes directly from the arterial capillaries into the venous sinuses of the red pulp. That is, the vascular system is continuous and closed. Here we can see this peninsular artery which carries blood, and it is directly poured into the splenic sinus. Or in this picture also we can see here. So this is closed circulation. Blood enters the red pulp veins. From here, blood enters the red pulp veins, which join together and enter the trabeculae as trabecular veins. This is trabecular vein. The trabecular veins join to form splenic vein, which emerges from the hilum of the spleen. Second theory is the open circulation theory. According to this theory, blood passes from the arterial capillaries of the penicilli into cords of Billroth. Here blood first comes into the cords of Billroth, not going to the splenic venous sinuses, and from there into sinuses through the spaces between the endothelial cells. Here, this is the penicillar capillaries. Blood from these capillaries first comes into the splenic cords, and from these splenic cords of Billroth, blood penetrates into this splenic sinus, which has discontinuous endothelium. In this process, the non-flexible old erythrocytes are retained in the cords and are engulfed by the macrophages, because blood first comes into this cord, which contains many cells and reticular fibers. So here, old erythrocytes are engulfed by the macrophages. There is another compromise theory which states that splenic circulation is closed in contracted spleen, and it is open circulation in the distended spleen. Here there are functions, as you already know: filtration of blood, production of lymphocytes, a reservoir of blood as a hemopoietic organ, and it has the role in phagocytosis of the old RBCs. This is clinical correlation of the spleen. It has many functions, but it can be surgically removed. That is called splenectomy, if there is indication of splenectomy. So we know that removal does not cause any adverse effect. Next is the enlargement of the spleen. It may enlarge after different diseases, for example, malaria, leukemia. This is called splenomegaly. In case of leukemia, the spleen may reinitiate its hemopoietic function and undergo a process known as myeloid metaplasia. Now we come to another lymphoid organ, Palatine tonsil. The palatine tonsil is a almond-shaped structure situated in the lateral wall of the oropharynx in the tonsillar fossa. Here is tonsillar fossa, the lateral wall of the oropharynx, and it is bounded by the palatoglossal arch in front and palatopharyngeal arch behind. Its lateral surface, which lies on the tonsillar bed, and is covered by the connective tissue capsule. But its medial surface is exposed and facing the pharynx. This is medial surface. And it shows many small orifices, which are 10 to 15 in number, which lead into crypts. Here we see the picture, histological picture. This is crypt inside the substance of the tonsil. The medial surface and this crypt, they are lined by stratified squamous epithelium, which is non-keratinized. If we see the crypt, on both sides of the crypt, there are lymphatic nodules, and they are present in the lamina propria. There is the epithelium of the crypt, which is stratified squamous non-keratinized epithelium, and these are the lymphatic nodules in the lamina propria. There are many mucous glands situated in the deeper part of the tonsil outside capsule, and their ducts open at the bottom of the crypts. Here we can see these are crypts. These are lymphatic nodules on the sides of the crypts. Majority do not open in the crypts, so chance of tonsillitis is more. Though tonsil belongs to MALT, mucosa associated lymphoid tissue, It is considered as an organ because it is partially surrounded by the capsule. Here is the high power picture of the tonsil. This is crypt of the Palatine tonsil. Epithelium stratified squamous non-keratinized. Along the side in the lamina propria we can see the lymphatic nodule. This is connective tissue in the lamina propria, and here are the mucous glands. Now we come to the applied anatomy. Tonsillitis, it may be acute or chronic. Tonsillitis is the inflammation of the tonsil. Acute inflammation or acute tonsillitis is the most common manifestation of tonsillar disease. It is associated with sore throat, fever, and difficulty in swelling. Tonsil may appear in normal sized or enlarged, but are usually erythematous. The mouth of the crypts may appear as purulent spots due to infection and pus formation. Here again a slide of the Palatine tonsil, and if we see the detailed picture, this shows the stratified non-keratinized epithelium. Now this is lymphatic nodules. These are the tonsillar crypts. Here we see the capsule on its lateral side. There is skeletal muscle outside. And these are the germinal centers in the lymphatic nodules. And these are blood vessels in the trabeculae. These are tonsillar crypts. Thank you.